Preservation Virginia is the nation's first statewide nonprofit historic preservation organization. And during our 135 years, we've helped save more than 400 historic places across the Commonwealth. We work with local, regional, and national groups and individuals to raise awareness of the economic and educational and cultural value of historic places, to commemorate and memorialize the full range and full telling of our complex history. Today, Preservation Virginia announces its 2024 list of Virginia's most endangered historic places. And this announcement is an opportunity to raise awareness of historic structures, viewsheds, cultural landscapes, and neighborhoods that are in some way threatened. The list is determined by an independent group of professionals and community experts in the fields of preservation, planning, history, local government, and education. And during the coming year, Preservation Virginia will work with the community groups that have nominated these sites to help raise awareness of the need to restore, repurpose, and revitalize these places. And so, without further ado, I'd like to introduce the list. Afterwards, we have three of the community representatives to talk in more depth about their historic pieces. And then we can take questions and start our work. Richmond Community Hospital, City of Richmond. Located on the north side of Richmond, the hospital, funded for and by the African American community, was built in 1932 to provide equitable and adequate health care. The structure sits vacant and neglected and faces an uncertain future as its owner, Virginia Union University, and its development partner, Steinbridge Group, pursue a development plan for this part of the campus.
First of all, I really want to thank Preservation Virginia for this designation because it validates what the community already knows and has known for decades, that the old Richmond Community Hospital building has historic value. I would like to acknowledge Alan Cencius, who is my co-partner in this movement. He is unfortunately unable to attend today, but we are documenting and recording our statements here today as part of this movement. I would also like to acknowledge and thank Dr. Leonard Ebbo, who's here today. He has been a strong advocate for the preservation of the site, and he has been out there fighting for its preservation for some time. I would like to thank the community advocates, Richmond area residents, and organizations and preservationists who are supporting the rescue of this building from loss, notably the Greater Richmond Foundation, Historic Foundation, and the Art Deco Society of Virginia. I would also like to thank the Black History Museum, the Jackson Project, and the Richmond chapter, Greater Richmond chapter of the Afro-American Historical and Genealogical Society, who early on wrote letters of support. They realize, as we do, that if this building is demolished, Richmond stands to lose part of its unique cultural and historic fabric. We stand to lose the stories of resilience and ingenuity within the Black community as it navigated Jim Crow. We stand to lose the thousands of stories of those patients who were cared for at this site from birth to death. Started in 1902 by Dr. Sarah Garland Boyd Jones, the first African-American woman in Virginia to be licensed to practice medicine, along with 30 of her Black physician colleagues, this hospital was part of a larger national Black hospital movement occurring in the days of segregation and Jim Crow. It provided the space where Black doctors could treat their patients and where Black patients knew they would be treated with equity, dignity, and respect. Today, this history is threatened to be erased by the lack of vision the vision of what it could become through rehabilitation and adaptive reuse. We say to Virginia Union University that a historic marker is not adequate, and that the rich heritage of the site could never be reduced to writing and placed on some plaque. We say that the community is steadfast and determined in seeing this site preserved and reborn. So, to the university and to those who care about preservation, the site, its future, Black healthcare history, or telling a richer, more inclusive story about Black Richmond, we say, join us. And join us in this year, 2024, because significantly, this year marks the 90th anniversary of the year in which the doors were open to care for Black patients and for Black physicians to practice in an arena in which they could deliver healthcare in an equitable manner. And those doors were open 1934, July 4th. So, in honor of those 90 years, the community will be planning a special celebration of 90 years of celebrating the history of equitable healthcare in Richmond, surrounding Richmond, and to and for the Black community. We ask you to join us. We have a sign-up sheet in the back if you would like to be involved in what we're doing. This is the history, the hidden history of equitable healthcare, not only in Richmond, but in Virginia. And so we are thankful to all of the community organizations and the people in the community who understand the importance of this preservation. Thank you so much, and thank you, Preservation Virginia, for honoring us with this designation. We know that it will help us to continue to elevate and engage the community in the significance of this preservation effort. Thank you very much.